Hello, good evening. Good to see you all again. It is autumn at last. The wind has become cool. I'm Sang-Chul Lim of Dentium. I'm really happy to join this live surgery show as a moderator. I welcome everyone to the Dentium Live Surgery show tonight. Dentium Live Surgery show visits worldwide Dentium users twice a month with cases on various topics. Today, just like last time, we invited Dr. Zheng to have a surgery. I would like to special thanks Dr. Zheng for his hard working on every Dentium live surgery show. This live surgery keeps on giving to us. Today's topic is a simple implantation with minimalism concept with the Dentium bright tissue level implant fixture. I expect this procedure will be a great help in your clinical practice. Thank you. Okay, let's take a look at today's case. Today's case, as I mentioned before, simple implantation with the minimalism concept and using bright implant system tissue level. 73 years old female patient. She want to have fixed prosthesis. Her lower jaw. Past dental history as follow. Implantation on number 44, 46 in November last year, and she wear mandible RPD. And about this past dental history, before starting the surgery, when she came, the dental clinic, the Well Dental Clinic, the first visit, the panoramic view, as you can see, number 33, 34 to number 43. The 7-unit long bridge are here. With the RPD, she won't have a fixed dentition, but at the time, the final treatment was 2 implantation on lower right jaw and with the implant-supported RPD. So this one is number 44 and 46 areas installed a bright implant tissue level. And what about number 43? 43 is failed, actually the ruined tooth. So this canine tooth should be extracted. So at the same time with the implantation number 44 and 46, this canine was extracted and socket preservation procedures are simultaneously. And simple, the fixation of flap with a pin and the additional suture was done. And this, the procedure was done November last year. So after this surgery, the denture design was done by CAD/CAM, as you can see. So finally, the deliver to patient mouth, as you can see, the implant supported and actually natural teeth supported RPD on the patient mandible. However, the patient doesn't want anymore. This RPD is not satisfied to her mouth and chewing the procedure during the chewing. So for satisfaction of our patient, Dr. Zheng is going to have another procedure. So 2 anteriors more and 2 posterior more, left mandible, lower jaw, and finally Dr. Zheng want to make fixed prosthesis for his patient. This one is the last year, November, when the 2 implant on the right mandibular jaw was installed situation, as you can see. And this one is implant-supported RPD situation. The already installed number 44 and 46 areas make a bridge, support RPD, and with like a surveyed crown, and left side natural teeth, number 34 and 33. And these two teeth was working as a surveyed crown for supporting RPD. Now we can see the CT view number 43, 32, 35, 36. All of these areas enough the vertical and the bone volume, and some areas not enough horizontal, but this one is not significant situation. However, what about the bone quality? Bone quality looks like so soft. The sponge bone and the trabecular pattern, we can see this bone type will be could be soft. So we have to consider this kind of bone quality situation. We have decided little bit different type of implant system. So finally, Dr. Zheng want to have a bright implant system tissue level because of this patient, also the elder, the 73 years, the elder person, and softer bone. So all of this situation need something special to install implant system. So finally, this bright tissue level is optimized to this situation. As I mentioned before, the surgery plan is here. The implantation on number 32 and 35, 36, 43. Added like this 4 implant fixtures make final the fixed processes. Okay. At this time, Dr. Zheng is using bright tissue level. How fast implant installation when we use a bright tissue level? We can see clear on this in this today's surgery. A simple Plablis implantation on number 32 and 43 area. And also, Dr. Zheng is going to have a Plablis surgery number 45 and 46, 35 and 36 area. So we can see clear the posterior Plablis surgery using this simple bright implant system. And we can see the bright tissue level so unique anatomic design, the gross anatomy of these fixtures. The gross, the anatomy grows, this design looks like here, double thread and the fat belly system. It means gave us a strong insertion torque, initial stability when we have softer bone, when we met softer bone of the patient, right? So sharp, thin and deep and thread and sharp thread design. It promotes easy implant placement, good initial stability as I mentioned before, and bone implant contact areas make higher, preserving alveolar bone, cause of fat belly styles. This design make spreading the occlusal load when the final lacerations inserted here. And so also this one is the optimized for immediate loading, immediate implantation, right? And one more unique style, the built-in type screw abutment. So top portion of this picture have a built-in type screw abutment style. So the finally actually this fixture have external connection, right? So it is the big difference between the previous version, the ordinary previous tissue level version, as you know, even though the tissue level, the internal connection, 8 degrees connection, sometimes 10 degree connection, doesn't matter, Morse tape, and there are many different connection type. However, internal connection, right? But this bright tissue level have external connection. It is a big difference between the previous one and this one, new one. What about the similar case? This one is optimize this bright tissue level implant to optimize lower anterior, like this area, narrow reach, and simple implantations needed areas. We can choose bright tissue level like this one. Small incision or flap-less surgeries are available for insertion this fixture. Just tap and the two drill and the insertion, that's it. And connect with the healing abutment, working as a scan jig. So simultaneously we can have an intraoral scan or the bite tray technique and so on. So finally we got the simultaneous custom abutment and the PMMA temporalization or faster final lastrations also available. So all of these, the component, the optimized to digitalized procedure. Look, as you can see, a very nice, well done implantation on the proper position, lower anterior, as you know, as you can see. So we can make like a temporalization and the finalization with the zirconia final prosthesis. All of these procedures are simple and faster than any other system, especially bone level, because of this tissue level have ready made the built-in type, built-in type screw abutment connection, right? So the final lacerations view, the panoramic view, very nice. Another case, what about the posterior area? This bright implant only optimized for anterior? I don't think so. If you want to have a posterior, you can choose this bright tissue level NTI system for posterior also. As you can see, just a small tap incision or semilunar incision is enough to have implant installation. And temporalization with the PMMA and the final lacration. All the procedures are the faster and the simple compared to bone level implant fixture. So sometimes you can choose like this tissue level, the unique, the customized, actually the screw abutment, built-in type screw abutment style. Okay, let's move to surgery room. Yeah, Dr. Jung is starting the anterior area. Incision, crestal incisions are here. And make a position, proper position. Actually, these areas, can you remember these areas? Canine extraction socket areas. The previous procedure was socket preservation using osteon 3 collagen, right? Almost 1 year later, I think the bone quality will be good. So using this high-speed taper Fisher bar, making a position. Okay, small tap incision and taper Fisher bar, a high-speed Fisher bar, make a position, and changing the drill, the Lindemann drill. This Lindemann, the white band, the bottom of white band, as you know, 9 millimeter. Top of white band is 11 millimeter. The bright implant system has odd number lengths, 7, 9, 11, 13, right? So now he is checking the ridge width. So we got the information from CT view, this target area. However, before starting the drill, Dr. Zhang is checking again the width and tissue tone and tissue thickness. Especially when you have a flap surgery, we have to check soft tissue thickness, right? And then the drill, the Lindemann drill, and the parallel pin. The parallel pin is a very important, the essential part, before the final drill and implantation. Checking the path and parallel. Checking the parallel. And if you have the angulation was not so good, if you want to have changing the angulation at this time point is the proper time point. Before starting the final drill, you can use Lindemann again to correct proper position and angle. And after that, you're going to go the final drill. Yeah, just only 2 drilling and then the insertion of a fixture. Okay, John. Okay, the fixture inserted on number 32 area. Can you see the apex of the fixture? The apex of the fixture is very the taper and the steep and sharp, looks like a sharp style. And this fixture, the clear recognize fat belly, the middle portion of fixture, the recognizing fat belly, right? So why that this bright system have the sharp apex? Because of the efficiency of insertion, right? So the self-tapping, to make higher efficiency of self-tapping, and then the initial stability. But however, you don't worry about the overthinking or over insertion of this picture. Cause of this tissue level have a neck portion, so this neck portion looks like the tap working like a tap. So we couldn't go inside the expected drilled previously, right? When you have 11 millimeter drilled, these fixtures doesn't go inside over 11 millimeter. Why? The top portion have the neck portion have a tap and tugging the bone crest. So this one is another the safety devices. Number 35 area and number 36 areas are drilling. Now, all these areas was done by flap surgery. No graft materials, no flap reflections, and even though the narrow reach, using the narrow diameter of the fixture, and the insertion, that's it. This concept is minimalism. Actually, this minimalism concept is starting in the 1960s and early 1970s in the architectural field. Dr. Zheng borrowed this concept from another field like architecture, the minimalism concept borrowed to adapt to the dental field. Number 35 areas was done. Diameter. This one is 4.0 diameter, 4.0, 7 millimeter. 4.0, 7 millimeter implant fixtures. I think a very nice, well done, the installation. Now, he is making a semi-lunar incision on this number 36 area, cause why? He want to make a little bit apically position these keratinized tissues to move to downward on the buccal side. For this purpose, he make an incision and the slight flap reflection and move to downward of the buccal. Hold this keratinized gingiva, move to downward and move to buccal area. So it means same effect as apically positioned prep, right? Yeah. Okay, can you see this keratinized gingiva, the cross implant fixture, cross the fixture to move to buccal side. Very interesting. The technique. Make an incision, semi-lunar incision on the lingual area, and then the flap reflection here, undermine the flap reflection, and the moving the cross the implant top portion of the implant fixture. So this flap move to buccal from the lingual. There are no vertical incision, just semi-lunar can make this procedure so unique. Okay, this one is a scan comfort cap. This scan comfort cap working as a dual function, working as a scan jig when you use intraoral scan, and another purpose, another function is healing cap, right? So the dual function, the scan comfort cap, to connect to install tissue level bright TL system. Yeah, I think after insertion, after surgery, he will take intraoral scan, the digital impression by using the intraoral scan, making a temporalization, the PMMA, and sometimes if you want, custom abutment also. Okay, the suture to fix the across the keratinized tissue. The suture is simple. The very similar to horizontal matrix suture style. Yeah, I think this minimalism concept is very nice and good choice for our elder person. This patient, 73 years old female patient, maybe he got the lower the quality of the bone and softer bone and not enough keratinized tissues and thin the soft tissues, all the conditions not favorable to normal procedure for final restorations, especially fixed dentition with the implant insert, like a 6 implant insertion or 4 implant insertion. However, this applied minimalism concept just the proper positioning implantation and connect each other for final restoration. Okay, today's surgery is too short actually. However, we can see clear how can we apply this bright tissue level implant with our elder person. Just making a proper position and then just 2 or 3 drilling procedures and then insertion. That's it. Okay, no pelvic flexions, no bone grafting materials, and no the complex procedure. Okay, so let's apply the minimalism concept to our elder, the senior person. Okay, thank you for watching, and we will have a 10 minutes break, and I will back in after 10 minutes. Thank you. Thank you for waiting. Welcome back. Now, let's take a look at the after post-op CT view. As you can see, number 43 area, diameter 3.5, 9 millimeter, bright tissue level NTI inserted. And number 32 area, diameter 3.0, 9 millimeter. 35 area, 3.5, diameter 9 millimeter. And what about the number 36? Finally, 4.0 and 7 millimeter, right? So especially, we will have this specific design, special design. This tissue level, the bright tissue level design, have a unique, the gross anatomic style. First, dome-shaped body. I want to say the fat belly style. This design gave us big advantages. What kind of advantages? First, even more primary stability, as you know, right? And more cancellous bone contact. It means even osseointegration and the faster osseointegration. And finally, marginal bone preservation. All the implants have the concentrate, the loading force, the top and neck portion. So this portion contact to the cortical bone of the marginal bone area. However, this tissue level, the bright implant have the marginal bone preservation concept due to this fat belly style body design, right? Another one unique style, as I mentioned before, the external connection. This external connection have a 20-degree to compensate each direction. So all directions and all the paths can be compensated because of this the 20-degree the external connection type. Okay. The question is here: is it possible to complement the molars sufficiently with 4.0 diameter of dentium bright this tissue level? Of course, yes. We can use this 4.0 diameter on the molar area. The very good question, the excellent. Thank you very much. For example, we can use 3.5 on premolar, right? 4.0 molar. It is a little bit smaller when we expected. Actually, normal diameter, as you know, the molar area 4.5 or 5.0, right? Especially bone connection, the bone level, the stable connection. However, this tissue level, or the one body style, one body type, so even though the smaller diameter, the stronger than the bone level implant fixture. So we can trust, we can use this a little bit, the one size smaller actually, 4.0 is a little bit small on the molar area. If this 4.0 was the bone level implant, however, the tissue level is totally different story, especially like this, the external connection type built in the screw abutment design doesn't matter. And the strong connection, strong the initial stability, all of these the advantages concentrate to make the easier application of elder person, especially softer bone and the poor condition of the soft tissues tone, right? So finally, yes, we can try, you can try, and also I will have trust this smaller diameter when you have molar and posterior position, right? Okay, thank you for watching today. Even though the short video, short live surgery, short streaming, however, we can see clear how can we apply this bone level implant simply and quickly for our elder person. Thank you very much. Next live surgery will be this month, October 21st, and 7 o'clock. Okay, thank you. See you then. Bye.